Hi everyone, and in this video I'll be discussing drugs for diarrhea. So you all know that diarrhea is nothing but passage of loose stools. Now the problem in diarrhea is patient is losing the water as well as electrolytes. So 1 or 2 episodes not an issue, but if he passes more and more loose stools, the problem is electrolyte imbalance. So whenever you manage a diarrhea, so what you need to take care is, first one is the fluid replacement. So you have to replace the fluid. Now the fluid replacement can be done in two ways. If the patient is taking orally, we can give a solution called oral rehydration solution. If the patient is not able to take orally and if he is severely dehydrated, then I have to give IV fluids. So the IV fluids which are commonly used are RL, that is ringer lactate, and normal saline. These are the two things. Now, what is the composition of ORS? Let us understand. What is the composition of oral rehydration solution? The WHO formula. Now, according to this new WHO formula, it contains of sodium chloride and it will be around 2.6 grams. Potassium chloride, it will be around 1.5 grams. Then we have something called sodium citrate, and that is present around 2.9 grams. And the glucose is around 13.5 grams. So this is the composition of the new formula WHORS. Now, why are we adding this? Sodium chloride and potassium chloride will replenish the lost electrolytes. So whatever the electrolytes are lost, that is replenished by sodium chloride and potassium chloride. Sodium citrate will treat the acidosis. So that will correct acidosis. And glucose, you know that glucose is given so that sodium absorption is increased. You have a transporter in the gut that is called sodium glucose transporter 1. And the glucose along with that, it will take sodium also inside. So this is the ORS. Now where to use ORS? Uses of ORS is in the management of diarrhea. So that is the first thing to be started. Second, it is also used for burns patient. If the patient is having heat stroke, there we use it. And also while managing cholera, the drug is used. So that is about the oral rehydration solution. You all know that how to mix it. So take a sachet, mix it with 1 liter of water and used within 24 hours. So once you do the rehydration, the second important thing is what you need to do is stop the secretion, stop the motility. So we have drugs which are called anti-motility drugs. So what are these anti-motility drugs? They are nothing but opioids. So what is the name of the opioid? The name of the opioid is called loperamide. So loperamide is the drug and it doesn't enter the brain. It doesn't cross blood-brain barrier. It acts only in the periphery. What does it do? Loperamide in the gut decreases the motility of the intestine, as well as it decreases the secretions. So that is the advantage. So it decreases the motility and decreases secretion. That is what we require in diarrhea. Now, where to use it? It is used in secretory diarrheas. So it is used in secretory diarrhea as well as in case of traveler's diarrhea. But it is contraindicated in case of infective diarrhea. It is contraindicated in infective diarrhea. What is the reason for that? The reason is simple, because when we use the drug loperamide, the motility of intestine decreases. When the motility decreases, the intestine cannot throw the bacteria out. So the bacterial infection can flare up if you are using it in infective diarrhea. In infective diarrhea, the problem is the infection may flare up. flares up because you have stopped the intestinal motility. The other contraindication of loperamide is it is also contraindicated in children less than 4 years. What is the reason why it is not used in less than 4 years? It has shown to cause toxic megacolon. Toxic megacolon in children less than 4 years, and also it has shown to produce paralytic ileus. The reason is it's a decreaser of intestinal motility. Similar to that, we have one more opioid. The name is called diphenoxylate. Everything is same to same like loperamide. Then what is the difference? Diphenoxylate can cross the blood-brain barrier. Since it causes a blood-brain barrier, it's an opioid, so patient will develop abuse because the drug will produce pleasant effect, that is euphoria. So patient will forget the diarrhea because he is getting euphoria. So that is the reason the government has made a rule. Whenever you give diphenoxylate, you have to add atropine. So atropine will also cross blood-brain barrier and the patient will have confusion because of this. So this is the combination given for treating diarrhea, that is the traveler's diarrhea and the secret diarrhea. But why do we give this combination? Is to decrease the abuse potential of opioid. Sir, should we do the same thing for loperamide? No need, because loperamide doesn't cross the blood-brain barrier and there is no risk of any addiction or abuse potential. Only with diphenoxylate you have to combine atropine. So once we are done with that, let us move on to the next category. So I told you the second category is antimotility, and the third category of drugs what we are going to use are the anti-secretory drugs. The anti-secretory drugs, the name is called resicadotril. Now resicadotril is a prodrug. It's a prodrug. After metabolism, the drug will give rise to a compound called thiarphan. So thiarphan is the active form. It inhibits an enzyme in the gut. In the gut, it inhibits an enzyme called N-cephalinase. You know that N-cephalins are endogenous opioids. So when you inhibit this enzyme, there is increase in N-cephalin in the gut. So in the intestine, the N-cephalins increase. So you know the action of opioid on the gut, they decrease the motility. But here, what do? The N-cephalins, they only decrease secretions in the intestine, and they will not have no effect on motility. So that is the reason most of the pediatricians nowadays they prefer resicadotril. So you can use it in all kinds of diarrhea. The drug is resicadotril. You can use it in infective, non-infective, secret diarrhea. You can also prefer that in children less than 4 years also. So only difference between loperamide and this is loperamide has effect on motility, but this doesn't have. That is resicadotril for it. Now another important drugs which are also newer drugs for diarrhea. So let me tell you then some of the newer drugs which can be asked in the exam. A drug by the name telotristat. So telotristat is a drug which inhibits an enzyme called tryptophan hydroxylase. So it inhibits an enzyme called tryptophan hydroxylase. You all know that tryptophan will give rise to serotonin. So what happens if serotonin is excess? Which condition? Carcinoid tumor. So carcinoid tumor will lead to diarrhea. So by blocking tryptophan, it decreases serotonin. So it is approved for which condition? It is used in carcinoid syndrome where there is diarrhea. So one is telotristat, which is used in diarrhea because of carcinoid. One more drug is called crofelemer. So crofelemer inhibits particularly the chloride channels. By blocking the chloride channel, the drug decreases diarrhea. Okay, it blocks the chloride channels. So where do you use it? Crofelemer is used to treat HIV drugs associated diarrhea. HIV drugs associated diarrhea, where we use it. The name is crofelemer. One more drug, what we all know, it is called as clonidine. Clonidine is a drug which is used for patients with diabetes having diarrhea. So for that it is used. So clonidine has shown to decrease the secretions, decrease the motility, and that is used for diabetes type 2 diarrhea. So these are the new drugs which can be asked in your exams. And one of the older drugs I just want to comment here, you all know it. It is octreotide. So octreotide is a drug which is used in secret diarrhea, for example, due to VIPoma, carcinoid, and also it is used in any other secret diarrheas. We use this octreotide. You all know that octreotide is a somatostatin analog. Now apart from this, the other drugs what we use for diarrhea is, nowadays we add probiotics. So probiotics, what do you mean by that? Probiotics, these are the bacteria which are helpful for human beings. Example for probiotic is lactobacillus, and one more is bifidobacterium. Now what do they do? How probiotics help in diarrhea? They will dislodge the pathological bacteria. They will remove the pathological bacteria from the gut, and they will replenish the normal flora of gut. That means normal bacteria of gut. So most of the physicians will also add probiotics in the management of diarrhea. One more thing that has been added, particularly in pediatric patients, are zinc. So zinc is added in pediatric patients. Now what is the reason why we use them? So zinc has shown to decrease the intestinal secretions. So it will decrease the intestinal secretions and decreases the damage. It has shown to decrease the damage and restores the intestinal epithelium. So the epithelium which is damaged during diarrhea, that is intestinal epithelium, is restored, and also it decreases the severity and duration of diarrhea. So that is the reason why zinc is given in pediatric people. So these are the drugs. Now another important aspect we need to understand in managing diarrhea is to give antimicrobial therapy. So what are the antimicrobial therapies what we need to give? Antimicrobial drugs. So what happens in the hospital setting? Empirically, any diarrhea, if you suspect it is due to the bacteria or due to the entamoeba histolytica, that is amoebiasis, what we do is we give fluoroquinolone plus metronidazole. So that will cover the gram positive, gram negative anaerobe, as well as it will also cover the amoebiasis. But if I talk about specific therapy, suppose a patient is having salmonella food poisoning and because of that having diarrhea, then what should we use? So that time it is better to use IV ceftriaxone. If that is not used, you can also give oral ciprofloxacin. So we all know that salmonella can cause food poisoning. Suppose a patient is having traveler's diarrhea and we know that travelers diarrhea. So the treatment can be with ciprofloxacin, or we can add rifaximin for this. Right. Then another important condition, cholera, it's very rare, but we may get it. So what we can give is doxycycline. And Clostridium difficile, which causes the pseudomembranous colitis, also can present with diarrhea. So the drug of choice nowadays is oral fidaxomicin. If that is not given, what you can do is you can give oral vancomycin. So patient having amoebiasis, you know the drug of choice for amoebiasis is metronidazole. So in Indian context, along with metronidazole, what we add up is diloxanide, furoate. This furoate will kill the luminal cyst. So it is a luminal amoebicide. So another cause of diarrhea is giardia lumbar. For giardiasis, you can use either tinidazole or you can use metronidazole. So treating of the infection is very, very important. Right. So these are the important aspects I had to discuss with you all. Management of diarrhea. So management of diarrhea, keep in mind, if the diarrhea is very mild, you can only treat it with just replenish the fluid, ORS. So one of the exams they had given this question, patient came with 1 or 2 loose stools, what is your next step? Don't give antibiotics, just give dehydration therapy. So if the patient is able to take orally, give ORS or give IV fluid. Then if the diarrhea is severe, you can go with anti-motility, anti-secretory drugs, you can use probiotics, you can also add up the zinc in pediatric population. And if you suspect bacterial or the protozoal infection, treat accordingly. So this is how we manage a case of diarrhea. Okay, thank you all.